You're listening to the Beauty Beyond Bella podcast, powered by Formula Wellness.
I'm your host, Dr. Yvette Suarez, owner and medical director of Bella Excellence, a diamond-accredited anti-aging med spa in the Tampa Bay, Florida area. On this show, we explore the latest trends in health, beauty, and anti-aging medicine while celebrating the inspiring journeys and achievements of our guests. Hi. So today I'm actually have a guest, which is ChatGPT, and we're going to be calling her Alex today. And I thought this was going to be a really important segment because, like most of you, I think everyone is using AI now to get their information. And so we want to make sure that we're getting as much medical information as true as possible, but also that you're going to a physician to get that collaborated. So welcome, Alex.
Thanks, Dr. Yvette. I'm thrilled to be here. You're right, AI is a powerful tool, but it's crucial to balance tech insights with expert medical advice. Let's dive into how we can make that collaboration work.
Don't you love that? So let's use these tools for our resources. So Alex, can you tell me a little bit about what are people looking up when it comes to menopause symptoms?
Sure. People often search for symptom relief, hormone therapy options, lifestyle changes, and natural remedies. They're looking for trustworthy sources to guide them through managing symptoms effectively.
I love that. So what would you say were the most common symptoms that a woman would experience during menopause?
The most common symptoms are hot flashes, night sweats, mood changes, sleep disturbances, and changes in metabolism. These vary in intensity, so personalized advice is key.
I agree. I feel like when women are coming in, they're mostly looking for ways to feel better. They're complaining about fatigue and sometimes hair thinning and hot flashes, memory, focus, libido. These are all really important symptoms that women are coming in for. And we do have amazing treatments with bioidentical hormones. Can you tell me and elaborate a little bit more on the benefits of both pellets and intramuscular injections for bioidentical hormones?
Absolutely. Bioidentical hormone pellets provide consistent hormone levels, releasing small doses over time, which can lead to fewer mood swings and more stable energy. Intramuscular injections are more customizable in dosing, but might have more frequent ups and downs. Both methods aim to balance hormones, improving overall well-being.
That's great. Do you have any statistics on the improvements that it would do both for heart and cognition on bioidentical hormones?
Yes, studies have shown that bioidentical hormone therapy can improve cardiovascular health by maintaining healthy cholesterol levels and reducing arterial plaque. For cognition, balanced hormones have been linked to better memory, focus, and overall brain function.
I love that. I think these are really important issues that women are having. Now let's dive into andropause and what issues are men having.
Absolutely. For men, andropause can involve fatigue, reduced muscle mass, mood swings, and decreased libido. Addressing these symptoms with hormone therapy can improve energy, mental clarity, and overall well-being.
Again, spot on. So it's really interesting by using AI, we can get people information that's out there and kind of alleviate fears and know that there is a way to treat these symptoms. So I thank you, Alex.
You're welcome. It's great to help bridge that gap and provide some clarity. Always here to support.
So now that we've kind of discussed what the medical facts are in it, can you give me what your opinion is about treating bioidentical hormones?
While I don't have any personal opinions, the data suggests that bioidentical hormones can be effective when managed correctly. Combining them with expert medical guidance ensures the safest and most beneficial outcome.
So what about now we have a lot of conversations regarding weight gain, weight loss, decreased lean body mass as we age. And so we struggle in this country with obesity. Can you tell me the statistics on obesity in the United States?
Currently, around 75% of US adults are overweight or obese. By 2025, it's projected that 36% of Americans aged 15 and over will be obese, with 7.6% severely obese.
And those numbers are so detrimental, correct? We want to see people living healthier lifestyles. What do you see when people are Googling right now for weight loss? What are they looking for?
Most people search for sustainable weight loss methods, balanced nutrition plans, and effective exercise routines. They're also interested in understanding metabolism and mental strategies to stay motivated.
That's great. Do people look at what the macro and micronutrients are and are really trying to get a great
nutrition plan?
Yes, there's a growing interest in understanding macros like protein, carbs, and fats. Many also focus on micronutrients to ensure overall health and balanced nutrition.
I think for me, we see a lot in the office when people are trying to lose weight, particularly women. We definitely don't get enough protein in our diet. I feel like if we are doing an active life, we need to be closer to probably 1 to 2 milligrams per kilogram per day of protein. And women in my office are really only getting about 30 to 50 grams of protein. Can you explain why protein is so important?
Protein is vital for muscle repair, immune function, and overall energy. It also supports lean body mass, which is crucial for metabolism. Ensuring adequate protein intake can help maintain muscle and support weight management.
I agree. And I think when we're trying to lose weight, particularly for women, we're not hungry on a lot of the medications now. The most common being the GLP-1s, where the appetite is going away. And so women are choosing to eat less and less protein because they're not hungry, which can really affect us detrimentally by losing a lot of muscle mass also. Can you tell me a little bit of information what you know about GLP-1s?
GLP-1 medications are used for weight management by reducing appetite and improving blood sugar control. While effective, they can lead to decreased protein intake if not carefully managed. It's important to ensure balanced nutrition and muscle preservation while using these medications.
And what has been the success when using GLP-1s as far as weight loss?
GLP-1 medications like semaglutide can lead to up to 14.9% weight loss, while tirzepatide can result in up to 20.9% reduction. Results vary, and some individuals might need to manage side effects carefully.
That is so true. And I think important for people to know, and everybody reacts to these medications differently. And so it's really important to start at a low dose and go up gradually. You don't need to be at the highest doses. I think it's really important to work with your medical provider and making sure that you're at a safe dose that's getting you great results. Do you agree?
Absolutely. Personalized dosing with medical guidance ensures effectiveness and minimizes risks. It's all about finding that balance and supporting overall health through gradual adjustment. Dr. Yvette, what's your approach to tailoring doses for individual patients?
That's a great question. So normally we start at a lower dose and we go up systematically every couple of weeks depending on what our goal is. How many pounds are we looking to lose per month? What is our current diet plan? Are we making sure that our nutrition is optimized? And those are all going to be really important to stay safe and effective.
That makes a lot of sense. It's a holistic approach, balancing medication with lifestyle factors. Have you found any strategies particularly helpful in motivating patients to stay consistent?
Yes, we're always trying different things. I think that really is ultimately up to each individual. We use different modalities that will actually help them be motivated. And again, I think women need to probably stay off the scale. I think, including myself, we get up and the first thing we do is get on the body scale. And we know that our weights fluctuate depending what our metabolism is doing, depending if we're perimenopausal or menopausal. So it's really important to stay optimistic and make sure also that we're taking lots of vitamins to supplement our nutrition. What do you feel about vitamins and how important they are for our system?
Vitamins play a crucial role in filling nutritional gaps and supporting overall health. They can be especially important when dietary intake is inconsistent. Have you found any specific supplements particularly beneficial for your patients?
I have. I really believe in magnesium and vitamin D. We also do some lipo or MIC injections with B12 to really help support the immune system, the metabolism. Which vitamins do you prefer when people are losing weight?
Magnesium and vitamin D are excellent choices. They support bone health, mood, and muscle function. B12 is great for energy and metabolism. It's all about a balanced mix tailored to individual needs.
Thank you, Alex. So as you can see, you can really get great information from ChatGPT, and we're calling her Alex today. So let's move over into the IV therapy world. What's the conversation going on right now?
IV therapy is gaining popularity for its quick nutrient delivery. People are curious about its benefits for hydration, energy, and immune support. What trends are you seeing with your patients?
I definitely see a big trend in people wanting to come in and get vitamin C at higher doses. Also for performance, right? Having the amino acids. And probably my favorite would be the glutathione push at the end Can you tell me what the studies show or what the great benefits of glutathione and vitamin C are?
Glutathione is a powerful antioxidant, supporting detoxification and reducing oxidative stress. High-dose vitamin C boosts immune function and collagen production. Together, they enhance overall wellness and skin health. Are patients noticing these benefits?
They definitely are. We are having people come in both on the aesthetic and wellness side. For aesthetic, people are looking to feel a little bit better, have brighter skin, have thicker hair. And then on the wellness, again, we're all looking to not feel fatigue, to have that more energy, to have more focus, and even to detox our body. As we know, we don't make the best choices. And so having something to kind of help improve our internal system has been a game changer.
That's fantastic to hear. It's great that patients are seeing benefits in both aesthetics and wellness. Do you find that certain treatments are more popular with specific age groups?
I do. I definitely would say not only age groups, but even sex groups. So the men will love to come in and do more of the performance IVs and to try to make sure that's help. Or we call them the executive ones that are going to help with mental clarity. The women both want the mental clarity, but also the skin brightening and hair restoration treatments. My favorite, again, for treatments that may help with decreasing cancer risks and detoxing the body, would it be anything with vitamin C, glutathione? What are the studies that you've seen that you can talk about with the treatments for decreasing cancer risks with vitamin C or any other vitamins? The Formula Wellness 4 cornerstones are nutrition, functional wellness, aesthetics, and brain health. These serve as a guide rail for individuals that are pursuing longevity inside and out. Formula Wellness is setting the new benchmark in preventative healthcare and aesthetics. Thank you for all of your support. To learn more, please visit www.formulawellness.com.
Studies suggest that natural sources of vitamin C can lower the risk of some cancers, though evidence for glutathione is more limited. Always best to consult professionals to ensure safe use. Are you noticing a shift in patient attitudes towards preventive care with these treatments?
Absolutely. I think we have been such a reactive country in treating things later on and not really prevention. And now we're shifting into a world of prevention, which is going to be really important. What's your opinion on working on prevention and wellness instead of waiting till you become sick?
Prevention is key to long-term health. Focusing on wellness can reduce risks and improve quality of life. It's encouraging to see this shift toward proactive care. Are there specific strategies you recommend to patients starting on this journey?
Yeah, so we're looking at a comprehensive lab panel, which is really going to be systematic of what's going inside, and also a plethora of questions. Where have they been? What's their past medical history? And what do they want to see for their future treatments and where they want to go? Because I think that's going to be different for all of us depending on what season in life we are.
That's a solid approach. Understanding individual goals and histories creates personalized, effective plans. How do you typically guide patients in setting realistic wellness goals?
Well, that's very important. I think, and I always tell people that it took us 50 years to get here. It may not get better within 2 weeks, but this is going to be our goal. And particularly when I look at women for bioidentical hormones and men, and when we're doing these pellets, each time that you do the treatment, you're actually going to get better and better. And I always tell people it may take 1 treatment, 2 treatments, 3 treatments until we get our goal. And that's going to be systematic to help with symptom relief and also start to improve wellness, right? We want to see improvement in heart disease and cholesterol and blood pressure. There should be a full body transformation.
That's a great perspective. It's a journey, not a quick fix. How do you keep patients motivated through these incremental changes?
So I'm all about follow-up. I might be a little bit too much. I really want to make sure that I'm seeing my patients every month, that we're getting either a quick call on the phone, or if it's for weight loss, to just come in and do a full body analysis and look at all different parameters. One of the ways that I like to motivate my weight loss patients is not just looking at adipose tissue and how much fat that we have, but looking at what our visceral fat is. I think it's so important to understand that our fat around our organs, which is very detrimental to our health, is more important than just our pinchable fat. Can you tell me a little bit and define for our audience what visceral fat is and what danger that can B?
Visceral fat is the fat stored around internal organs, linked to higher risks of heart disease and metabolic issues. It's more harmful than subcutaneous fat because it can impact organ function. Tracking and reducing visceral fat is key for overall health.
I agree. So in today, we have a lot of insulin resistance and diabetes. Can you tell me statistically how many people are either currently diabetics or insulin resistant?
In the US, about 38.4 million people have diabetes, and nearly 40% of young adults are insulin resistant. Are you seeing these trends reflected in your practice?
I am, and those trends really scare me. I think 40% of insulin resistance is a big red flag that we really need to work on prevention. Not only treating it afterwards, but we need to get our amazing young people, and even as we get older, to really take a step back and really care about their wellness.
Absolutely. Early prevention can significantly reduce these risks. Are there specific lifestyle changes you recommend to help patients manage insulin resistance?
Well, there's many. So I think the first thing is going to be always nutrition, what we're putting in a nutritional diet plan, a nutritional plan for what kind of vitamins that we're going to support the system, how to decrease stress and anxiety. What are the statistics right now that people are suffering with anxiety or stress?
Recent surveys show that 43% of US adults report increased anxiety compared to last year. Major stressors include financial concerns, the political climate, and work-related issues. Are you seeing these factors impact patient health as well?
Well, I feel like stress is a big deal when patients are coming in. And that's definitely multifactorial, definitely something that I need the patient to buy into to helping themselves, right? We can give patients different ways to improve, but this is definitely a journey that they need to take initiative in, control of. And as they go through this journey and start to feel better and better, it will become so much easier for them to have a well-balanced lifestyle.
Absolutely. Patient engagement is crucial. When they take ownership, results often follow.
So Alex, there's a big conversation piece currently about doing NAD vitamin injections. Can you tell me a little bit about that?
Sure. NAD plus injections are known for boosting cellular energy, improving brain function, and supporting anti-aging. They help repair cells and reduce fatigue. Have you noticed patient outcomes reflecting these benefits?
I have, and I've actually noticed that a lot more patients are coming in and asking for that. And so I was wondering, where are they getting this education from, whether it's going through ChatGPT or looking online. And so I think most people are now looking for things that are going to help them, right? It's all about longevity of life. It's all about feeling better and prevention. So this has really been great to get people to start doing these injections because, as we know, it's really difficult to get a lot of this support through our nutrition currently.
That's fantastic. It's great to see proactive approaches gaining traction.
Let's talk about vitamins and the importance of getting vitamins that are either a medical brand or that are third-party tested versus getting things over the counter.
Sure. Medical grade or third-party tested vitamins ensure quality and potency. Over-the-counter supplements can vary in effectiveness. Do you guide patients on how to choose the right products?
We do. Not only are we testing them in our laboratories, but also just discussing how important that is. And we obviously have a medical brand here, but it's really explaining to patients the importance of that. I even feel that over-the-counter medications, a lot of the B vitamins are not methylated. A lot of the vitamin D, maybe only D3 and not have vitamin A and vitamin K to help drive it in. So it's really important for us to do that educational platform of why medical vitamins are so much superior to what they're getting over the counter.
That educational piece is vital. It ensures patients understand why quality matters for effective treatment.
Can you explain the benefits of taking a vitamin D with vitamin A and K?
Sure. Combining vitamin D with A and K enhances calcium absorption and supports bone health. It helps balance calcium levels and reduces risks like arterial calcification. Are you finding patients respond well to this combined approach?
Yes, they definitely respond quicker and more sustained, where with just D3, we're getting a little bit harder to get the levels that we want. Alex, tell me a little bit about why methylated B vitamins are important versus just traditional B vitamins.
Methylated B vitamins are more easily absorbed and utilized, especially for those with MTHFR mutations. They support energy, mood, and cognitive function more effectively. Are you seeing a difference in patient outcomes with these?
I am. And can you tell our guests what the difference is and what percent of patients are on MTHFR?
Around 20% to 40% of certain populations have the MTHFR mutation. It affects how well they metabolize folate and B vitamins. Are you noticing that this impacts treatment plans?
I do. I feel that many people are coming in folate deficient and B12 deficient. And so having that conversation that not everybody's able to methylate. And so sometimes you think you're taking these vitamins, but you're just not absorbing it. And so thank you very much for clarifying that.
You're welcome. It's great that you're addressing these nuances with patients. Personalized care really makes a difference.
So I think when we're ending this conversation, I would love for you to tell our audience on how important prevention is in today's world and to decrease obesity, to help with menopausal symptoms, but just in general to decrease heart disease.
Prevention truly sets the foundation for long-term health. Addressing issues like obesity and menopause symptoms early can lead to a healthier heart and overall well-being. Small, consistent steps can make a big difference.
So Alex, when looking for a provider, especially in this kind of topic, there's many people that are not been further educated in the metabolic process. And so I think it's really important being a fellow and having my fellowship done in anti-aging and metabolic medicine. What kind of recommendations would you give patients when they're seeking a medical provider?
I'd suggest looking for providers with specialized training in metabolic and anti-aging medicine. Board certifications and continuing education are great indicators of a solid background.
Thank you so much, Alex. It was great having you on.
Thanks for having me.